Hi there, this is Professor Walton. So, for this lesson, we are going to complete a case study. So I want you to go and pull out your resource, whether it be your textbook, your ATI book, your Saunders NCLEX prep book, whatever it is that you have for preparing for the pediatric course that you're in, and look up meningitis. I want you to grab a piece of paper and a pen. You'll be pausing the slides, answering the questions, and then we'll have some reflection. So first, to get started, I want you to answer these 3 questions on your own, and then we will move on. Keep in mind, newborns and infants are at the greatest risk for meningitis. All right, based off of your reading, what can you tell me? So go ahead and pause. Tell me about bacterial and viral meningitis and the characteristics that distinguish both from one another. So for bacterial, generally this is more severe. The symptoms are more serious. You have a fever, change in feeding, vomiting, diarrhea. You have that anterior fontanelle bulge. You have the altered level of consciousness, vomiting, headache, joint pain, photophobia, and that nodular rigidity. If you have some labs, you'll see a decrease in white blood cell count, an increase in those white blood cell counts, an increase in protein, a decrease in glucose, and that cerebrospinal fluid will look what? It'll look cloudy. So if you have a viral meningitis, you're going to see an increase in white blood cell count and protein. They won't appear as ill. There'll be an abrupt onset of a fever. You'll see meningeal signs like malaise, vomiting, diarrhea, respiratory signs. You'll see some macular papular rashes, and seizures are very rare with viral meningitis, and those symptoms resolve in about 3 to 10 days. We have our case study. We have Katie. She's a 17-pound, 4-month-old. She was admitted to the hospital with meningitis, and her prenatal history, lab, labor, and delivery had all been without difficulty. According to her mother, growth and development up to this point had followed a pattern and was very similar to her siblings. Katie had not had any previous illnesses. Thinking about Katie, the possibility of meningitis, since this is what type of case study we're doing, what organisms are most common in causing meningitis in children older than 2 months? Did you find that in your research? So with bacterial, you'll see Neisseria meningitis or Streptococcus pneumonia. And then with viral, you'll see the enterovirus. Generally, you might find this in infants that are less than 2 months old that aren't vaccinated. What vaccine should we be encouraging? They probably need the Hib vaccine and the pneumococcal. Prior to admission, Katie had begun to run a fever, but otherwise appeared to be behaving normally. On the day of admission, she wasn't taking fluids very well, and her temperature was 40 degrees Celsius. Do you know what that is Fahrenheit? And the pulse was 160. Do you know what her normal pulse should be? Her anterior fontanelle felt full and slightly tense. Koenig's and Brudzinski's signs were noted to be sluggishly positive. Do you know what that looks like? You may want to do some research. She appeared pale and lethargic. So what signs of meningitis is Katie exhibiting? Pause, write your answers down, and then we'll talk about it. Okay, so she is exhibiting fever, that tense fontanelle, the Koenig and the Brudzinski sign, and she is lethargic. Did you come up with anything else? Do you know what the Brudzinski sign is? Do you know what the Koenig sign is? You have a couple links here, so go ahead and go watch these videos and help to implement that into your brain. Oftentimes, some of these signs can get a little bit crazy. I mean, they're not really telling because they are named after whoever, come up with it. So, keep in mind these are going to indicate meningeal irritation, but go ahead and pause, go watch these videos. Now we're going to look at early versus late signs of increased intracranial pressure. So go ahead and do that. Make yourself a list on your piece of paper of the early signs and the late signs, and then we're going to talk about it. So what did you come up with for early signs? Did you see those sunset eyes as in number 1? Number 2, headache. Number 3 and 4, you have that increased head circumference and those wide sutures, and then you see the dilated scalp veins. 5, dizziness. 6, nausea and vomiting. 7, bulging fontanelle. 8, changes in those vital signs. 9, we have irritability and that high-pitched cry of that little baby there. And then 10, visual disturbances such as double vision, pupils not reacting, number 11, or they're not equal. And then you have that they are lethargic. Okay, what'd you come up with for late signs? Not near as many, right? So you've got that Cushing's triad with those vital signs. So what do you see? You see that increased in systolic blood pressure and that widening pulse pressure. You see bradycardia. You see irregular respirations. And then on number 2, you're seeing that stupor, that decreased level of consciousness to where they're almost unresponsive. Number 3, we've got a little kiddo with seizures. And number 4, fixed and dilated pupils and that papilla edema with that optic disc swelling. Secondary to what? That'd be secondary to that intracranial pressure that is increased. Just talk about the decerebrate and decorticate posturing. So I just want you to look at this again. I want you to be familiar with it. I know we talked about it in the last discussion that we had, but go ahead and pause the video and just read this, look at it, get a good visual, and take time to study it. So here is just a visual of that triad that Cushing's triad that we talked about. So you see that increase in that systolic widening pulse pressure. You see that bradycardia, and oftentimes you see Cheyne-Stokes respiration. So that's rapid breathing followed by periods of apnea. Do you know what the classic signs of meningeal irritation is? Go ahead and pause and let's think about that. And what are you thinking? So often signs and symptoms of meningitis are often preceded by what? Fever and headache and irritability. So with that being said, some classic signs can be found in your textbook, but we're looking at headache. It's usually in the frontal area, photophobia, an inward eye deviation, estropia, nodule rigidity, that is going to be a resistance to neck flexation, and then a positive Keurig and or Burdinsky sign. Is that what you all came up with? So now take a look at Katie's results. Are they consistent with bacterial meningitis? So just kind of make some notes. Are things high? Are they low? And then compare them with what you see. So pause the video and do that. All right, so she had a spinal tap. Her white blood cell count was 3,200. That's increased, right? Her glucose was 15 mils per 100 mil. So what? That's low, right? And then her protein was 112. So you see that increase in that protein. And then you have a causative organism of Haemophilus influenza. So what type is that? That's a bacteria, right? When we look at the spinal tap, you can see a little picture, and this is positioning for this procedure that kind of opens up the spinal column and the vertebrae so that we can actually get that spinal fluid. So just a really good position there. So keep in mind the child may be very scared, so let's do some education with not only the child but the parents. Here you see manifestations and those levels. So, whether it be bacterial or viral, you can kind of see what is going on. So with this one, we seen that their white blood cells were elevated, right? And we had the protein that was elevated, and then we had the glucose that was decreased. Katie has what type of meningitis? She has bacterial. All right, so what's the medical treatment for meningitis? I want you to pause and go look that up. All right, I know you guys are doing great at this point, and you are getting all of the answers correct, right? So, there's going to be different types of medications depending on what they are. So there's going to be five. Do you know what those five are? If not, I'd like for you to go and look at them. They're going to be getting antibiotics, they're going to be getting steroids, they're going to get Tylenol, and then, they're also going to be getting that IV fluids. So when we look at level of precautions, we're going to be looking at the neurological sequel. So, that hearing loss, seizures, behavioral problems, and then, the CDC recommends droplet and standard precautions for at least 24 hours after the antibiotics are initiated. And then another precaution is going to be post-exposure prophylactic. So they're going to be getting rifampicin, Cipro, ceftriaxone, and then some also immunizations are important. So what are some nursing interventions to decrease that intracranial pressure that you came up with? So you're going to monitor, right? You're going to monitor for signs of that increased intracranial pressure. They're going to be on a strict INO. They're going to have urine-specific gravity looked at. You're going to monitor electrolytes. You're going to want to weigh the child and use that coma scale to assess their level of consciousness, right? So, to decrease that intracranial pressure, we're going to want to prepare them for the procedure, administer mannitol, sedate them, have whether it be IV or hypotonic solution for that mannitol, the doctor will determine that. And then again, there'll be that sedation with that analgesia and paralytic agents. We're going to want to keep the head of the bed at 30 degrees, keep it midline to promote that venous drainage, right? We want to avoid any hip flexation. And then, we want to have their neuromotor system and their neurothermia maintained. And then we want a quiet environment. We want them to have a urine catheter, and then they're going to have internal feeding if, they have that increased intracranial pressure, and we need to do something about that, right? So keep in mind the incubation period for meningitis is often 2 to 10 days. So you may not see that right at first. Here we have where Katie is getting IV therapy. So she's going to get 250 mils, and they say to infuse it at 20 mils per hour. So they've put the IV line in the left foot, which is appropriate. So can you figure out how long it'll take to infuse that 250 cc bag at 20 mils per hour? How long is it going to take for that to go in? So to figure that out, you take 250 and you divide it by 20, and that's going to give you 12.5. So that would take 12 and a half hours. So, is this safe based off of her weight? So she's 17 pounds. No, it's not. It should be 32 mils per hour. So if you go back and look at safe rates for children based off of their weight, you'll be able to figure that out. So, you have to figure out how many kilograms per mils she can get per hour. So how do you figure out how many kilograms this child weighs? You take the 17 pounds and you divide it by 2.2, and that's going to give you the 7.7. So again, the safe rate for this child, if you go back and look and you do your calculations, is going to be 32 mils per hour. But the initial question, how long will it take, is going to, the answer for that would be 12 and a half hours. Katie was started on clear liquids after that 24 hours, and she tolerated the formula in the same amounts as pre-hospitalization within 4 days. Her temperature returned to normal within 48 hours. Her head circumference remained the same throughout her hospital stay, and the anterior fontanelle became soft and level. By her 5th hospital day, Katie was smiling and cooing and appeared excited when the nurses approached with feedings. She was discharged after a 10-day course of IV penicillin. Arrangements were made at the time of discharge for her to return for a hearing screen. Can you tell me why there were arrangements made for a follow-up hearing screen? Go ahead and pause if you don't know the answer and look that up. Let's see if you're right. That is because she's at risk for a severe neurological sequel. So that is going to be hearing loss, seizures, and other issues like behavioral problems. This is a consequence from that pressure and from the disease and the injury that she sustained. So, she's definitely at risk for that sensorineural hearing loss. Is that what you came up with? What can we educate on about prevention for her parents? So go ahead and pause and write down your answers, and then we'll go over them. Okay, so immunization. So that Hib, pneumococcal, and that meningococcal vaccine needs to be given. So that's between 11 and 18 years, and then 11 and 12 years old. So good personal hygiene, washing those hands with soap and water. Don't share food, glasses, water bottles, or eating utensils. And don't share tissues or towels. Don't share lip gloss or lipstick. I know my daughter sure did that. And, the other thing is just keep your body healthy, right? Okay, well, good job, guys. I'm super proud of you and proud of how far you are coming along. You have a great rest of your day.